24th April to 30th April, we'll celebrate World Immunization Week. And this is the time when we want to reflect on importance of immunization and vaccines as life-saving tool that help us to save millions of lives every year and everywhere around the world. This year theme is Vaccines Work for All, and it's not just to reflect on vaccines as tools, but also on all these people who help us to develop, deliver vaccines to people who need them, and children all over the world. My name is Alexandra Kuzmanovic, and I work in the Department of Communications in the World Health Organization. And it's my pleasure to have with us, joined remotely today, Dr. Kate O'Brien, our Director for Immunization, Vaccines and Biologicals. Good morning, Kate. How are you? Thank you very much for joining our program today and explaining to our viewers on the importance of immunization and vaccines, especially during COVID-19 pandemic that we are facing nowadays. Would you explain to our viewers where are we with the vaccine development for COVID-19? Many people are asking us when the vaccine will be ready and how we can access it. So could you please elaborate on that for the beginning?
That could be deployed as quickly as possible. So we're at the beginning of the development phase, but this is a highly coordinated effort to get the best minds, the best effort, and all energy put towards actually developing vaccines, assuring that they're safe, testing them to assure that they actually work protecting against COVID. And we don't have a guarantee for when that vaccine or multiple vaccines will actually be available. This is developing vaccines takes uncertainty and it takes time to assure that they are safe and effective. So we're hoping that this can be done as quickly as possible, and we've already started the process of doing some tests in humans.
Thank you, Kate. I'm receiving some comments from LinkedIn viewers that the sound is low. We are working on fixing that. Thank you for your feedback. And also, I'll use the opportunity before we continue discussion with Kate to invite all of you following us on Facebook to ask your questions about immunization through the comment section, the same on LinkedIn, and on Twitter, please use hashtag AskWHO. Kate, while we are waiting for viewers to ask questions, could you also explain to viewers how is COVID-19 pandemic impacting the regular immunization services?
Yeah, so apart from the focus and appropriate focus on developing a COVID vaccine, we all need to remember that we already have vaccines that are available for many diseases that themselves cause outbreaks and have been in the past very serious causes of serious illness and many, many deaths in people. And those vaccines are a success. So what's really key during this COVID outbreak is to assure that we don't stop the vaccinations against those things that we already have vaccines against. Measles, some pneumonia causes, some causes of diarrhea, diphtheria, polio. In some regions, there are countries that are affected by yellow fever, cholera, or typhoid, and we have vaccines against those important diseases as well. So now is not the time to step back from immunization programs. In fact, now is the time to assure that we're doing an even better job getting all children and all people who need those vaccines for their own protection to be vaccinated.
Thank you, Kate. Thank you, Kate. What is WHO's advice? Should immunization services still continue despite the COVID-19?
Yeah, that's a great question, Alex. At WHO, we have put out advice for all countries to sustain immunization programs through the COVID-19 pandemic. Immunization programs are considered part of the essential health services, and we've called on all countries to maintain those programs wherever possible. If there have to be some interim pauses while countries are getting organized and assuring that healthcare workers have the protective means possible to be able to continue immunization and to be safe doing so. Those pauses should be as brief as possible, and all services should be maintained to the degree that is feasible within any country. That also means that parents need to know that they should be taking their kids for vaccines. It's of no use to have the services available if parents are reluctant or don't realize that they should continue vaccinating their kids, even while we're working our way through this the COVID situation.
Thank you, Kate.
Thank you.
We understand as well that many parents and caregivers may be concerned to take children for vaccinations to health facilities during COVID-19. Do we have any advice for them how to ensure that they are protected when they go there?
Yeah, let's just be really, I think it's really important for parents to understand that the reason that we have routine immunization services, the reason that every child should be vaccinated against those diseases for which we have vaccines and that are common causes of illness if they're not vaccinated, because children need to be protected. We've seen this, huge outbreaks of measles in last year and the year before, and we really are worried about having even bigger measles outbreaks if parents don't take their kids for vaccination, and if the vaccine services are not as strong as they need to be, if those services are not available to people. So for parents, please, the big message is get your kids vaccinated, get them vaccinated on time. And you can do that safely. You can do that by knowing where the services are, knowing where you can go to get the immunizations, and following the guidance that has been put out there about hand washing, about physical distancing, and just paying attention to those in sensible ways while you're getting those essential services for your kids.
Thank you, Kate. There is as well a concern of protection of health workers during COVID. What is WHO recommendation for those who are providing vaccines, giving vaccines to our children?
Yeah, so for the most part, the large most part, kids who are coming to get vaccines are healthy. And parents, in large part because of the physical distancing, are also likely healthy. So for healthcare workers, what we're really emphasizing is the supplies for the healthcare workers, because they're seeing large numbers of people, supplies for them so that they remain protected against the possible exposure to the COVID virus. So we're really emphasizing that for immunization services, it's about healthcare workers setting up the clinic system so that there is a degree of physical distancing that stands up, is aligned with the guidelines that have been provided, that healthcare workers have the accessibility of either gloves or hand washing or sanitizing facilities between the kids that they're immunizing, and that they have appropriate protective masks. Remember, we're not trying to protect at that time from a lot of people who are infected with COVID at immunization services. These are largely fully healthy people. And it's really about healthcare workers having to see a large number of people that they need some protection.
Thank you, Kate. Thank you very much. I would just like to remind our viewers that we are currently having Q&A on immunization. As from tomorrow, we are marking World Immunization Week for 2020. Thank you all for your comments and questions already coming in. So Kate, here's the first one. One of our viewers says that clean water and good sanitation are the best ways to defeat common diseases. Could you please comment on that and explain why should we still get vaccinated?
So the viewer's comment is completely right. Sanitation, hand washing, respiratory, being careful about respiratory secretions is important. However, there are many diseases for which we are unable to fully protect kids that way. First of all, we have some diseases for which the pathogen, the germ, actually lives in our own body, and we're not able to prevent that acquisition of the germ. And the example of that would be pneumococcus. That's the most common cause of serious pneumonia in children. And the other reason why we need a belt and braces approach is that even in settings where we have full accessibility of those hygiene type interventions, children are still at risk of transmission of some of these germs. Measles is a really good example of that. For every case of measles that occurs, somewhere between 12 and 18 or 20 other people will get infected if they're not immune. And so we can't guarantee who people are in contact with and what their exposure will be. So vaccines are the best way to provide immunologic protection and full protection of kids against a range of germs that each are life-threatening in their own right. So that's the reason why we don't step back from vaccines. Vaccines have been shown to be the most cost-effective, one of the greatest, most impactful public health tools that we have to provide a great start, healthy start to the lives of children, and to protect adolescents and older adults and pregnant women against these diseases for which we have fabulous products that are safe and effective.
Thank you, Kate. Here we have a next comment from Raj Kumar. Is it true that there are certain foods which boost the immune system?
So a healthy diet, all of the elements of being a healthy person are all components of assuring that you're offering the best opportunity to have a healthy life. There are certainly, states of malnutrition which really impact the immune system, and there are balanced, healthy diets and foods that can really enhance your health and well-being. So there are no specific foods that are going to provide protection against each of the germs for which we have vaccines, but really encourage people to assure that from a nutrition perspective, those are sensible, healthy lifestyle choices.
Thank you, Kate. Here is the next question from Jerry Kiev. Are you facing resistance by anti-vaxxers on COVID-19 vaccination? We don't have vaccine yet, but do we have already some comments from anti-vaxxers on these efforts?
The sort of anti-vaccine voice has been around for as long as we've had vaccines, and that's hundreds of years. We've had smallpox vaccination going back hundreds of years. So it's not something new to have anti-vaccine voices, and there are certainly anti-vaccine voices around even for a vaccine that we don't have yet, and for a pathogen, a germ that is causing COVID-19 that is obviously having devastating consequences around the world. So it's not unexpected that we will have voices around opposition to vaccines, but those voices are really not based in science. And I think we have to focus on where the data is, where the evidence is, and where the public health benefit is. So we will look forward to the development of a COVID vaccine and hope that those steps can happen as quickly as possible, and that we'll have as accessible as we possibly can, as quickly as possible, a vaccine that will start to provide some benefit to all countries around the world.
Thank you, Kate. I'll use this opportunity to ask you and to remind our viewers, what are the science-based facts that we know about vaccines, that vaccines work?
So all vaccines go through a very rigorous testing process. Most of the time, the development of a vaccine takes anywhere from 10 years to even more than that. In some cases, it's taken up to 30 years to actually get a vaccine that is effective at doing what it's intended to do and is extremely safe vaccine. So all vaccines go through a very rigorous testing process. And even after we deploy vaccines and use vaccines in communities, among families, among populations, we continue to monitor all vaccines for their safety. In addition to that, most vaccines have been developed based on understanding why the disease occurs. Why does this germ cause disease? What is it about this germ? And the vaccines are designed to induce the human immune system, your natural protection, to be prepared for when you actually encounter that germ in the future. So that's the science that's behind vaccines and the strategies and mechanisms we have to keep monitoring vaccines all the time to make sure that we have the best vaccines, that they're given in a schedule that is going to provide the best protection, and that they're given at an age that is going to optimize the impact and the benefit of those vaccines.
Thank you. Thank you very much, Kate, for this summary and reminder that vaccines work for all. Here is another question from Rajendra Patel. What are the efforts that WHO is doing to make sure pharmaceutical companies work together and not competitive and in harmony in order to develop a vaccine?
So WHO has a number of sort of key roles to assure that we have as best coordination as possible. One of the ways that WHO works to do this is we develop the description of what we want a vaccine to do. And that description helps manufacturers design vaccines for the actual use that they're intended. The second thing that we do is we are the place, we are the environment where conversations between different manufacturers can take place, so that there is a sharing of information, approaches, and questions are answered, so that when the manufacturers are developing vaccines, they're using the best information possible about what we intend the vaccines to do, what we want them to design them to do, and what the intention is around how they'll be used. And the third way is that at WHO, WHO is the place where policy decisions are made, policy advice is given about how to use vaccines in country locations. And that advice is given by a strategic advisory group of experts that are experts from around the world who provide the oversight and the guidance on what those policies should actually be. So those are ways in which manufacturers engage with each other and in the discussion around what we're trying to get done, what is needed to actually have the public health impact that we're striving for, and what role they can play to assure that we have products that are safe, effective, available, and accessible for the communities and the populations that need them.
Thank you, Kate. Maybe we can use example of Ebola vaccine that was pre-qualified last year and helped us to save many lives in DRC in the still ongoing Ebola outbreak. Would you like to explain how that process worked?
Yeah, so that's a great example. So Ebola is one of these emerging infections. It's been around for many years. We've known about it, and it occasionally has outbreaks, and some of them have been large outbreaks and devastating outbreaks. And so several years ago, really significant effort was made to develop an Ebola vaccine. And that's a great example of where the different manufacturers were brought together by WHO, a very clear description of what we wanted a vaccine to be able to do. Different technologies were pursued by the manufacturers. And that vaccine was developed and deployed in the quickest time frame that we've ever had. The first deployment of the vaccine was through an evaluation of whether the vaccine could work to prevent Ebola. And then that evaluation was continued, and a very rapid approval process through WHO of the vaccine, so that it is now sort of verified to be a vaccine that can be used for Ebola. So that's an example of a very rapid development of a vaccine for an urgent outbreak situation, and the most rapid use of the vaccine to evaluate in real world circumstances what the vaccine can do to protect communities and individuals and families.
Thank you, Kate, very much. Thank you, Kate, very much. I see that we are receiving many questions, and I thank our viewers for being proactive. And I'll start now with the one coming from Tanya Cunningham. What is the advice for those with compromised immunity? Will live vaccines put their immune system under pressure and risk of COVID-19 virus?
So for I'm not going to answer any specific immune deficiency questions. For those people who have compromised immune systems, there are recommendations about which vaccines they can get that are safe to get and which ones might be deferred, depending on whether the immune problem is a temporary problem or a long-standing problem. So what we would be most concerned about is that for people who have immune system problems, they should be sure that their healthcare provider and their immunization clinic knows about that so that the vaccines that they receive are the right vaccines. For a COVID vaccine, again, we're expecting that there may be more than one COVID vaccine and there would be different strategies that would be used for COVID vaccines. We'll have to see what they are and what the recommendations would be for people who have immune compromising conditions.
Thank you, Kate. Here is a comment from Almami Seri Bangura. I also think in times like this, there is even more a strong need for community engagement with stakeholders to understand the need for routine vaccinations, particularly in some difficult terrains. Do you have any comment to this?
Yeah, I really love that question. I think we need to remember that every year, about 116, 117 million children worldwide are vaccinated with the core vaccines that are needed. These are life-saving vaccines against diphtheria, tetanus, pertussis, polio, measles, and beyond that. That means that even though we're succeeding in vaccinating millions of children every year, there remain almost 20 million children every year who don't get the full course of vaccines. And of those, a little over 13 million receive no vaccines at all. So in this time of COVID, this is a time when instead of stepping back, we should be stepping forward on immunization programs. It's really critical that children who are being born are best protected against all the other things that are out there over and above COVID. If there are outbreaks of diseases that are normally controlled or highly controlled by the vaccines we already have, and we start to have those outbreaks, the healthcare system, which is already really stressed by COVID, is going to have a second hit to it. So now is the time to really be emphasizing with the policymakers, with the governments that run immunization programs, private care providers, that immunizations are an essential health service and need to be maintained fully through the COVID crisis.
Here's the next question from Cecilia Antao da Silva. She says, elderly people need to get flu vaccine. How does it interfere with vaccination against COVID? As you explained, we don't have COVID vaccine yet developed, but would you be able to comment on elderly people and their flu shots?
Sure. So yes, flu or influenza is another virus, and it comes around every year. There are vaccines against influenza, especially at a time when we're very concerned about the elderly and the risk to elderly people of COVID. It's essential that elderly people are protected against the other germs that also cause respiratory problems. So that includes influenza, and we are emphasizing the immunization with influenza as one means of continuing to protect the elderly. There's also a vaccine against another cause of pneumonia in the elderly, the pneumococcus, which is a bacterium. And again, following country-based recommendations for the use of that vaccine for those people who live in countries where that vaccine is recommended for the elderly, strongly encouraging that people know what their vaccination status is, and if they haven't completed those vaccinations, either for flu or for pneumonia, that they get vaccinated.
Thank you, Kate, very much. Here is a question. You mentioned this at the beginning of our conversation, but our viewers may not have heard it. Not all of them. Is it safe to take children to a hospital for immunization, as in the same hospital are chances of exposure to COVID-19?
We're encouraging all health services to design in such a way the flow of patients and the flow of clients, because not everybody is a patient, they're not sick yet, or they're not sick, to design the services so that there is as safe a safe setup as possible. We're really encouraging through the guidance that for well child care services, which immunization is a component of, that those services are separated from, in some physical way, the flow of people coming in is separated from those people who are seeking care because of illness. So we are calling on the hospitals, clinics, healthcare service entities to organize the flow so that there is a separation of those two types of services. And in doing so, parents can be confident and comfortable that they can get their children immunized without conferring risk to them.
Thank you very much, Kate. I have another question. What's the progress we've made in the past few years on immunization? Do we have a growth in people who received life-saving vaccines, or we are stagnating at the moment?
So that's a great question. I'd love to answer that question. There are two ways to answer it. The first is when we look at the fraction of people who should be vaccinated who are getting vaccinated, and in the biggest sense, we have about 86% of kids who are worldwide who are receiving the core vaccines that they should be getting. Now that's a great number. In fact, vaccines have the widest reach and the sort of deepest equity of any public health intervention that we have. So huge success on the vaccine side. However, that number has been stagnant for about a decade. And what's really vexing is that the kids who are not being vaccinated remains stuck, and it remains stuck at about 13.5 million kids around the world. However, in addition to the actual coverage, the proportion of people who get vaccinated, we also have been introducing more vaccines into the schedule because new vaccines have been developed that are life-saving vaccines against germs that we previously didn't have any vaccines against. And so that includes, for example, over the past decade, the introduction of a vaccine against pneumonia in children, vaccines against diarrhea in children, and I've already talked a little bit about Ebola vaccine, which is a very special circumstance. We've also had the introduction of the HPV vaccine against cervical cancer. So we're making enormous progress in getting the development of vaccines against germs that we never used to have vaccines against, and the introduction of those vaccines in many, many countries around the world in a faster pace than we've ever had before. So the accessibility of those vaccines has really increased, in large part in the low-income countries and lower middle-income countries through the effort of Gavi, the Vaccine Alliance, which is an incredibly important organization that is an alliance of all of the partners who support vaccination around the world. So we're a bit stuck on the coverage. And that's not to say that every country is stuck or every community is stuck, but we're not yet seeing a real improvement in coverage for about the past decade. Holding steady, and we can't take that for granted, but we're not seeing substantial improvement yet.
Opportunity now to maybe reflect on measles outbreaks that we had around the world last year, and maybe to update our viewers where we at and what's the improvement made in this regard, thanks to vaccines.
Yeah, so I think everybody knows that last year was a really difficult year for measles. There were outbreaks that were occurring around the world. Some of them were very large outbreaks. And as a result, we estimate that there were over 800,000 episodes of measles. The difficulty that we have with measles is it's highly transmissible. And the issue there is that when we have measles anywhere, we have measles everywhere. And that's what we really saw, is that measles was moving not only within countries, but was moving across borders as well. And that means people who are traveling outside of their own country, maybe acquiring measles outside the country and returning home. It can also mean people who are visiting from one country to another country. And so the issue with measles is that we need to have about 95% of children being vaccinated against measles in order to really protect against having outbreaks. And the difficulty here is that's a very high number to achieve, but it is achievable. Most children receive the first dose of measles at about 87% globally, but we're still not where we need to be. The recommendation is that for every child to have 2 doses of measles vaccine. And we need to make much more rapid progress on assuring that every child is fully protected against measles. There is an effort, and many countries have achieved the elimination of measles, meaning that there's no measles circulation within the country. Measles cases may still occur in countries that have achieved elimination, but those are imported cases. So we're really calling on all countries to advance their measles program and to assure that every child is receiving at least 2 doses of measles. In this time of COVID, we're really concerned that even the difficult year last year on measles outbreaks may be surpassed if we see that immunization programs are not sustained through the course of the COVID situation.
Thank you, Kate, very much for this reflection and explanation, and also warning on what we need to do that we don't have the same situation, or maybe even worse, given the COVID context this year. How about polio? Thanks to vaccines, we had a great success around the world to end polio in many countries. Are these efforts as well now threatened by the pandemic?
So I think, as probably most viewers know, but I'll just say it in case they don't, there is a worldwide effort that has been going on to eradicate polio. And eradication means, if we were to achieve it, that there would be no polio anywhere around the world. There's only one human infection that has been fully eradicated, and that's smallpox. And so we don't give smallpox vaccine anymore because it doesn't exist anymore anywhere around the world. For polio, we're not there yet. There are 2 countries that still have wild polio virus circulating, but all other countries have gotten rid of wild polio virus. Again, the effort to get to the final end game on polio, to get rid of polio entirely, is under threat because of what's happening now with COVID. So at the moment, the campaigns for polio vaccine are being paused while countries are preparing and readying themselves and responding to the COVID situation. We do expect that those campaigns will start again. Polio vaccination through the routine immunization continues unabated, and every effort of all partners who are working on polio eradication is dedicated towards first assuring that countries are prepared and responding to COVID, and then to continue with the polio efforts in an even stronger way so that we can get to the end of the polio eradication effort.
Thank you, Kate. We know from many stories that polio vaccinators are real heroes on the ground, helping us to eradicate polio for good one day. And here comes the question from Sana Ulach about vaccinators. Is WHO developing guidelines for vaccinators regarding COVID-19, how they can protect themselves when vaccinating children? You mentioned that at the beginning as well, but our viewers are asking again.
Yeah, so we already have guidance around essential health services and around the kinds of things that people can do to protect themselves. We are developing very specific operational guidelines, on the ground, exactly what you should do around immunization services. What I can say at this point is that the common things, the basic things should be done. This is really about the encounters with otherwise healthy, largely healthy people. So we will be emphasizing hand hygiene and barrier masks for people who would be encountering otherwise healthy people. We're really emphasizing that this is not about the kinds of personal protective equipment that are needed when taking care of people who have COVID, This is really about encountering the general public, largely healthy children and their healthy parents.
Thank you, Kate, very much. You mentioned HPV vaccine, and the WHO have a big initiative to ensure that girls around the world are receiving this vaccine, and many countries are stepping up in these efforts. Would you like to share some information on this, please?
Yeah, so HPV vaccine is one of the really amazing vaccines that has been developed in recent years. Cervical cancer is the vast majority of cervical cancer is related to infection with human papilloma virus, a virus that ultimately, over a period of time, causes changes in the cervix and causes cervical cancer. And so having a vaccine that can be given to protect against cervical cancer is a really incredible major step forward to reducing the burden of disease that is felt by women around the world. And this is a vaccine that has been deployed in dozens of countries now. It's largely given to girls, but there are some country programs where it's given to boys also. And the most important thing about HPV vaccine is that it needs to be given before girls become older and start having exposure to HPV. So these programs are really important to protect all of the girls in all our communities from what can be a death sentence for them if they were to get cervical cancer and remain untreated. So this is a flagship program for us, and the advancement of these programs to make sure that every girl in every community has the opportunity to be protected against HPV and live a healthy and productive life is a really positive thing.
Thank you very much, Kate. And we received a question from Tanila Taskin, who is saying HPV vaccine is recommended for both male and female age between 9 to 13 years old and now up to age of 45. Should this vaccine be included into national vaccination program? Can you clarify what is the WHO recommendation on the age when people should receive this vaccine?
Yes, the WHO recommendation on HPV vaccine is about immunization in the young teenage years, so from 9 to 14 years of age. That's the time when protection is afforded before there is exposure to HPV. There are some countries that have provided a permissive recommendation in specific circumstances where for older people. But the best benefit of the vaccine is conferred, and the most cost-effective use of the vaccine is conferred to protect people before they have exposure, before they get infected. And that's the emphasis on immunizing between 9 and 14 years of age through the WHO recommendations.
Thank you very much, Kate. And a few last questions. We know that vaccines work for all, and that's what science has proven us. But for those who are not sure or are not vaccinating their children and themselves yet, what are the consequences if we don't get vaccines that we need?
So the vaccine preventable diseases that are out there, they haven't disappeared. As I mentioned before, the only germ that we've actually gotten rid of in the world is smallpox. So for every vaccine that we have, those are germs that are in every community, in every place around the world. For children who are not vaccinated, they remain at risk for those diseases as they are infants, children, and become adolescents. We can't protect our children from every exposure that they may have out there. And germs don't recognize borders, nor families, nor communities. And so the best that can be done for children is to provide them with the most protection from all of the things that they're going to encounter in their lives. And this gives them the opportunity to really have the best start at life. So these are the, I think, the main messages. We have fantastic vaccines that have been developed over years, given to millions of people with very, very clear safety around those vaccines. And these are the best opportunities that we can give our kids, and the most caring that we can provide for them.
Thank you, Kate. And this week, from tomorrow, we will also say thank you and celebrate all those people who help us develop and deliver vaccines. Could you name some of those professionals, and that we can say thank you to them together for helping us saving lives for years now?
Yeah, so I really want to emphasize the immunization workers who are out there. Most immunizations are given by nurses or community healthcare workers. All around the world, we have people in communities who are delivering vaccines, either door to door through polio campaigns or in clinics through injectable campaigns. So these are nurses, community healthcare workers. There are technicians. There are people who are monitoring vaccine preventable diseases, who are out in communities and in all of our villages, towns, cities, and providing those vaccines. We also have people who deal with the shipment of vaccines, who deal with the manufacturing of vaccines, who are dealing with paying for vaccines. So there's a huge network of people who work day in, day out to make sure that every vaccine is coming to your clinic in your community. And it's up to all of us to make sure that those vaccines are getting into either the mouths, the arms, or the legs of those who most need those vaccines. Our kids, pregnant women, adolescents, older adults, and also vaccines for you as healthy adults.
Thank you, Kate. Thank you very much for naming all these people who help us to keep the world safe. Big thanks to health heroes, as we like to say these days, and especially during this year of nurses and midwives. Once again, big thank you on behalf of WHO for everything you do to help us to save lives. I invite you all to follow our social media channels and our website for more information on vaccines. And also especially during the following week of the World Immunization Week. Thank you, Kate, for your time and for responding all these questions that we've received. Until next time, please stay safe, and big thank you. Goodbye.